the first time I met Devon Cross. We were both elbow-deep in a patient's chest cavity during a power failure, while a hurricane was trying to tear the hospital apart. I couldn't see his face, clearly just the top of his head. Dark curls damp with sweat, surgical cap skewed at an angle that would have made me laugh under literally any other circumstance. We were in OR 2-3 at Charity Hospital's surgical wing, working on a 34-year-old man with a penetrating thoracic trauma. And the emergency lights had been flickering for the last 40 minutes like they were considering giving up. "Sponge," I said. My hands were steady. They always were. 12 years of training, 5 years of actual trauma surgery, teaches you that the world can be falling apart, and your hands don't get to know about it. Already. "Got one ready," said a voice from my left. The cardiovascular ICU nurse who'd been pulled to assist in emergency surgery because every hand counted. His voice was calm, competent, and carried the specific tone of someone who'd done this before. "Vitals. BP's dropping," our anesthesiologist called from the head of the bed. 190 systolic, down from 210. The patient was losing blood faster than we could replace it. The trauma had nicked the left anterior descending artery, and we were racing against the math of Outside, I could hear the wind howling against the window's category for hurricane. They'd said, winds at 140 knots, storm surge expected to reach 8 feet. But that was someone else's problem. My problem was the 750 milliliters of blood this man was hemorrhaging every minute. "Bovie," I said. The nurse, Devon, according to his badge, which I'd registered in the periphery of my vision, was already moving, cauterizing the bleeder with the precision of someone who'd spent years learning where to apply exactly the right amount of thermal energy. Not too much tissue damage. Not too little the bleed would restart. Just right. He got it right. "Good catch," I said, not looking up from the wound that would have restarted in about 40 seconds. I know, no ego in it. Just fact. Pressure. Stable 180. We worked like that for another hour, no talking, except necessities. Just the synchronized movement of people who understood that this man's life was a calculation we were doing with our hands. The hurricane raged outside. The emergency lights flickered, and Devon Cross, lean, with the kind of efficient grace that came from knowing exactly what you were doing, handed me instruments before I asked for them, and anticipated problems before they became critical, around hour 2 of the surgery. The main generators failed. The lights went out completely for maybe 3 seconds. Then the backup system kicked in, and the surgical lamps blazed back to life with an electric hum. But we all felt it the moment when the hospital's heartbeat skipped. "We're on backups," the anesthesiologist said. "Everything's still running, but we've got limited power now." "How long?" I asked. 48 hours if they don't need to run anything else. Less if the backup generators fail. Less if not. When? Less if. I looked across the surgical field at Devon for the first time. I could see his face clearly in the surgical light-sharp cheekbones, intelligent dark eyes. A small scar on his left temple that suggested a story I didn't have time to hear right now. He was looking at me with an expression that was equal parts competence and concern. "We finish this," he said. "Then we figure out the rest. You're not even a surgeon." "No," he agreed. "But I know anatomy, and I know how to keep someone alive." He held up his hand steady. "Sure. Let's fix this guy." We closed in another 40 minutes. The patient's bleeding had stopped. The artery was repaired. His vitals were stable. By the time we were suturing, the wind outside had reached a fever-pitch category for becoming something worse. The hospital swang slightly with gusts that felt like they were testing the building's structural integrity as we moved the patient to recovery. Devon followed me. "Where are you going?" I asked, already knowing the answer. "ICU's overflowing," he said. "Hospitals requesting all available staff." They're setting up makeshift trauma units in the cafeteria, the conference rooms, anywhere we can hook up monitors. He met my eyes. I'm guessing they're going to need a trauma surgeon. I'm due for a break. No, you're not. You've been awake for 16 hours. But they're going to need you anyway. He was right. And I hated that he was right, because I was exhausted in the specific way that comes from surgery during a crisis, where your adrenaline is running on fumes and your body is running on spite. You're going to follow me around and tell me I look like shit, aren't you? I said. He smiled, small, genuine, the kind that actually reached his eyes. Probably. The ICU was chaos, wrapped in the illusion of control. We had 97 patients, 53 available beds, and a hurricane that was getting worse. The storm surge was rising. 3 emergency room attendants had called in to say they couldn't get back to the hospital. The bridge was flooding. The roads were impassable. We were operating with approximately 60% of our normal staff. And that was being optimistic. I found myself in the cardiac care unit, not my specialty. But we'd moved past specialty about 6 hours ago. We were past a lot of things. We were into the territory of whatever keeps people alive. Devon appeared at my elbow with 2 cups of coffee that tasted like burnt rubber filtered through despair. "Drink it," he said. "That's not coffee. That's a cry for help. It's caffeine. The flavor is negotiable." He drank his without flinching. "We've got a 42-year-old female post me 6 hours ago. She's stable on the monitors, but her oxygen saturation keeps drifting. I want you to look at her." I followed him to Bay 7, where a woman in her early 40s lay hooked up to what looked like every monitor in the hospital. Her chart was thick: pre-existing hypertension, family history of cardiac events. Had a minor heart attack 6 months ago, survived. This one was more serious. "How's her ejection fraction?" I asked, scanning the monitors. 43%. "We're hoping for recovery." But he trailed off, and I understood what he wasn't saying. In a normal hospital with normal resources, she'd probably be fine. In a hospital running on backup generators during a hurricane, with limited ICU beds and a mountain of other critical patients, she was a resource problem waiting to become a tragedy. "She needs monitoring," I said. "If the ejection fraction drops below 40, we're looking at cardiogenic shock. And if that happens during a power failure, then we do what we did in the our Devon said. "We figure it out together." There was something in how he said it together that made me look at him. He was standing in the harsh fluorescent light of the ICU bay, surrounded by the beeping of monitors and the howl of the hurricane outside the reinforced windows, looking at me like the world wasn't actively trying to destroy us both. "You're very calm for someone whose hospital is falling apart," I said. "You're very talkative for someone who hasn't slept in a day." He handed me a protein bar he'd pulled from his pocket. "Eat. You're going to crash hard if you don't." And I ate the protein bar. It tasted like cardboard mixed with regret, but he was right about the crash. I was running on the specific kind of tired that comes from too much adrenaline, followed by abrupt nothing. Around hour 3 of the backup generator operation, things got worse. The storm surge was higher than predicted. Water was in the basement. The electrical infrastructure was compromised. And we got a call that the backup generator serving the northern wing was flooding, which meant we had, maybe, 8 hours of power left on the main generator before it would be the only thing running the entire hospital. And 8 hours meant we'd have to make choices about who we could keep alive and who we couldn't. I was sitting in the ICU break room, a closet-sized space with a broken vending machine and motivational posters that had been there since 2008 when Devon found me. "They're asking if we can transfer non-critical patients," he said, "but the roads are gone. The airport is closed. We're stuck. How many non-critical do we have? 12. Maybe 14 if we're generous about non-critical. He sat down next to me on a chair that looked like it was held together by spite and duct tape. Marcus, we're going to have to pick who gets the ICU beds. I know. I knew. Triage logic. Red gets the bed. Yellow waits and hopes. Green. Green doesn't need a bed because they're stable. But what do you do when stable isn't a guarantee anymore? There's a patient in cardiac care, Devon continued. 42-year-old female, post me from 6 hours ago. If the power fails completely and she goes into cardiogenic shock, we won't have the equipment to save her. The woman from Bay 7. The one he'd asked me to look at. The one whose ejection fraction was precariously low. She needs a cardiac ICU, I said. Full monitoring, inotropic support, possible balloon pump if it gets bad. And if the power goes, then we do CPR until the backup power comes back, or until our arms give out. He was looking at me steadily. I'm not giving up on her. I need to know you're not going to give up either. There was a weight to that request that had nothing to do with medicine. It was about what we were willing to fight for. What we were willing to lose sleep and sanity and coffee that tasted like burnt despair over. I won't give up, I said. But Devon, if the main generator fails, then we figure it out. Together, right? Together again? Together, I agreed. The hurricane hit its peak at 2 a.m. The hospital was swaying actually. Physically swaying with winds that had exceeded the original predictions by nearly 20 knots. The windows in the patient rooms had reinforced shutters, but you could hear the violence of the storm even through them. It sounded like the world was being unmade, and that was when the main generator started making noises it shouldn't have been making. I was checking on patients in the northern wing when I heard the electrical whine change pitch. It went from a steady hum to a rising shriek, then cut out completely. The lights didn't go out. We were still on backup power in this section. But something was very wrong. I found Devon in the ICU command center, already on his phone with maintenance. How bad? I asked. The main generators flooded. Waters in the basement up to 4 feet. He hung up the phone. We're running on the emergency backup now. Total capacity. The ICU, the OR, if we have an emergency, basic life support throughout the hospital. Everything else goes dark. How long? 24 hours if nothing else goes wrong. 24 hours. Hurricane was supposed to pass in 12. But supposed to wasn't a guarantee. The cardiac patient, I said, Bay 7. Still stable, but oxygen saturation's been drifting. He met my eyes. We're keeping her on full monitoring. But if this backup fails, it won't. You can't promise that. No, I said. But I can promise that we'll do everything we can. And you're going to do everything you can. And she's going to survive because the alternative is unacceptable. Devon looked at me for a long moment. Then he reached out and squeezed my shoulder brief. Firm. The kind of touch that said, I see you. I believe you. We're going to do this. You should sleep, he said. Real sleep. 2 hours. I'll watch your patients. I'm not leaving, you're leaving. Because you're useless to me unconscious in a hallway, which is where you're going to end up if you don't sleep. He was already steering me toward the break room. 2 hours. I'll wake you if anything changes. I wanted to argue, but he was right. I was hitting the wall hard, the kind of wall where your judgment gets fuzzy and your hands start to shake. And if there was one thing I couldn't afford right now, it was fuzzy judgment. I slept on a cot in the break room for exactly 1 hour and 58 minutes before Devon woke me. She's in cardiogenic shock, he said, without preamble. Ejection fractions dropped to 32%. Blood pressure's falling. I was on my feet before he finished the sentence. We ran actual running back to the ICU. Bay 7 was exactly as bad as I'd feared. The patient's blood pressure was 110/60 and dropping. Her oxygen saturation was in the low 80s. Her heart was barely pumping enough blood to keep her brain alive. "We need to get her to the OR," I said. "Emergency intra-aortic balloon pump. We can't," the ICU resident said, young, scared, overwhelmed. "We don't have the power." "Yes, we do," Devon said. His voice was calm, but underneath it was something steel-hard. "We have emergency power for the OR. We have backup systems. We make it work." He was already moving, grabbing the crash cart, calling for transport, his hands steady and sure. And I understood, in that moment, that this man had done this before. Maybe not this exact scenario, but he'd been in situations where the systems failed and you had to use what you had. We got her to the OR in 4 minutes. Me, Devon, 2 ER nurses, and a sense of controlled panic that was somehow worse than full panic because you couldn't let it take over. The intra-aortic balloon pump insertion is a procedure that requires precision under normal circumstances. Under emergency circumstances with backup power and a hurricane raging outside, it requires something else. It requires trust. I needed someone whose hands wouldn't shake, whose judgment wouldn't waver, whose presence wouldn't add to the chaos. I needed Devon. "I'm going to walk you through this," I said as I scrubbed in. "We're doing this under local anesthesia, under emergency lighting, and I need you to not let me make a mistake." He was already scrubbing. "I won't. You can't. If I make a mistake, she dies." "I know." He met my eyes across the sterile field. "That's why I'm here." We worked for 90 minutes. Just the two of us. Mostly I'd sent the residents out because I couldn't have their fear in the room with us. It was just me, Devon, and the woman whose heart was failing. I inserted the catheter through the femoral artery, threaded it toward the aorta, placed the balloon pump. Devon anticipated every move, had every instrument ready, checked my work with the kind of attention that would have been insulting if it hadn't been exactly what I needed. When it was done, and the pump was running, and her blood pressure started to climb back up, I looked across the sterile field and saw Devon's eyes crinkle with relief. "She's going to make it," he said. "We're going to make her make it," I corrected. "But yeah, she's going to make it." We didn't leave the OR for the rest of the hurricane. We did 3 more emergency procedures: a ruptured appendix, a complicated delivery that needed surgical intervention, a trauma case that came in via helicopter, one of the last to land before the storm made flying impossible. Devon was there for all of it, his hands and mind and calm. Steady presence are constant through the chaos by hour 6 of the backup generator. I was running on fumes and coffee and something that felt like love, but I wasn't ready to examine too closely. The hurricane was passing. The storm surge was receding. And I was standing in the OR observation window, watching Devon place a central line in a new patient with the kind of focus that would have been beautiful if it wasn't so terrifying. "You look like you're about to pass out," a voice said behind me. I turned to find one of the senior nurses, Patricia, who'd been with Charity Hospital for 30 years and had opinions about everything. "I'm fine," I said. "You're not fine. You're in love, and love is apparently not teaching you to take care of yourself." She handed me another cup of terrible coffee. "That one Devon Cross, he's been asking about you every 10 minutes. Whether you've eaten, whether you've rested, whether you need anything. I haven't seen a man that focused since my husband was planning our wedding." "We just met," I said. "Today, we met today. And you've been covered in the same patient's blood, making life and death decisions together, saving each other's work under emergency conditions." Patricia shrugged. "How long did it take you to fall in love with your last boyfriend?" "That was different, was it? Did you save a patient's life with him?" Did he trust you completely? Did he look at you like you're the reason the hospital hasn't fallen apart? She pointed back toward the O where Devon was finishing the central line. That man came from the ICU. ICU nurses don't abandon critical patients unless they're absolutely certain the patient is stable and someone they trust is going to take care of them. He left his unit during a hurricane to come with you. He came because I asked. No, he came because you needed him. She squeezed my shoulder. Get yourself together. Dr. Hayes, you've got a patient to check on and apparently a man who's very interested in knowing whether you're alive. The hurricane cleared by dawn. The storm surge receded. The backup generators held. And slowly, carefully, the hospital shifted from crisis mode to recovery mode. We had casualties, but we didn't have a mass casualty event. We had people in critical condition. But we didn't have people dying in hallways because we'd run out of beds. We'd made it through. I found Devon in the ICU, checking on the cardiac patient from Bay 7. She was stable actually, genuinely stable. Her ejection fraction recovering. Her heart slowly relearning how to work. She's going to be okay, Devon said, not looking away from the monitors. Because of what you did. Because of what we did, I corrected. I couldn't have done the balloon pump without, I know. He finally looked at me, and his eyes were exhausted and grateful, and something that made my chest feel tight. Marcus, I need to tell you something, and I need to say it now before I lose my nerve. Okay, I said slowly. I came to Charity Hospital 8 months ago because I wanted a change. New city, new hospital, new everything. He was standing very still, like he was afraid that any movement would disrupt what he was trying to say. And I was fine with that. It was a good transfer, good work, good colleagues. But then I met you. In an operating room during a power failure during a hurricane. And you looked at me like you trusted me with someone's life. And you were right to trust me because I would have done literally anything to keep that patient alive. For you, he took a breath. And I'm aware that's insane. We've known each other for approximately 24 hours. 24 hours, I repeated. Yes, but I've also been present for you at your best competent. Focused, unwilling to pretend, you've been present for me at my best, which apparently involves not leaving your side. And I think that counts for something. He reached out, took my hand. His palm was warm, his grip steady. So what I'm asking is, when this is over, when the hospital's not falling apart and we're not running on backup power, will you let me take you to dinner? Somewhere dry, where the power's working. I looked at our joined hands, his dark against mine, both of them scarred from years of medical work, both of them steady. I'll do you one better, I said. I'll cook you dinner. My apartment, next week, when we're both off shift. And I'm going to make sure it's better than hospital coffee. He smiled. That is a genuinely low bar. I'm aware. But I'm confident I can exceed it. I squeezed his hand. And Devon, thank you. For today, for all of this, for being the person I needed. Thank you for being the person I didn't know I was looking for. He said. We stood like that for a moment to people in an ICU, surrounded by monitors and machines and the residue of a hurricane that had tried to destroy us. And I thought about how sometimes the best things happen in the worst possible circumstances. How sometimes you meet the person you're going to love in an operating room during a power failure. How sometimes the world has to nearly end for you to understand what matters. Come on, Devon said, pulling me gently away from the monitors. You need to sleep for like 8 hours. And then we need to talk about this dinner because I have opinions about chicken versus fish. Of course you do, I said. But I was smiling. Epilogue 3 months later, the hospital had been repaired. The backup generators were replaced with better ones. Life had returned to something approximating normal, but I'd met Devon Cross during a hurricane, and normal would never be the same again. We We're sitting on the balcony of my apartment, the one with the actually functioning power and the excellent coffee situation, watching the New Orleans evening settle in. Devon had his arm around me, and I had my head on his shoulder. And for the first time in 3 months, we weren't on a hospital shift or running on emergency adrenaline. "Do you ever think about that first day?" he asked. "The hurricane?" "Every time I see you," I said. "It's a pretty specific memory. I mean, do you think we would have met if the hurricane hadn't happened?" I thought about that. Maybe, eventually. The hospital's not that big. But we wouldn't have met the way we did. Elbow deep in a patient's chest cavity. Yeah, and it was the perfect way to meet you, actually. Because you didn't have to be charming or impressive. You just had to be competent and steady and willing to save a life alongside me. I lifted my head to look at him. "That's who you are. That's who I fell in love with." He kissed me soft, easy. The kind of kiss that comes after you've already survived the worst and come out on the other side stronger. "I love you too. Even though you make terrible coffee and have opinions about my surgical instincts. My coffee is fine. It tastes like despair and regret." That's hurricane coffee. Normal coffee is different. I settled back against his shoulder. "Speaking of which, I was thinking about something." "What?" "The hospital's putting together a hurricane recovery community outreach program, and I was going to volunteer." I paused. "But I was wondering if you wanted to do it together. We could teach emergency response training, talk about medical crisis management, make a difference in the community." He was quiet for a moment. "Then, is this your way of asking me to officially move in with you and stop pretending you want your apartment back? Maybe. Is it working?" "Extremely effectively." He kissed the top of my head. "Yeah, I'll do the outreach with you. I'll do anything with you, actually. You know that, right?" "I do now," I said. "I didn't 3 months ago, but I do now." We sat there as the sun set over New Orleans, as the sounds of the city started their evening chorus, as the world kept turning. And I thought about how sometimes the most important people in your life show up in the most unexpected ways. How sometimes disaster is just another word for opportunity. How sometimes the worst day of your life is the day you meet the person you're going to love forever. The first time I met Devon Cross. We were both elbow deep in a patient's chest cavity during a hurricane. By the time the hurricane ended, I was elbow deep in something far more important. I was falling in love.